Welcome to Technique Tuesday. We're going to talk about a few things I get a lot of questions about, and that's when to use ice, when to use heat. I already have a stim unit or electrical stimulation unit or TENS unit at home. How do I use it for my knee? And I'm also going to throw in about elevation, how to elevate effectively, what it does, how to help with swelling, all coming up on today's Technique Tuesday. Ice. Ice bags, you can buy these. These are reusable, gel packs in the middle. Pros and cons, they're reusable, easy to keep cold. Get a layer between your skin and the ice bag or the gel pack, usually a little cloth or a sheet. Get as much of that area that's tender, sore, painful, or achy covered with that ice. And you have to leave it on there until it gets numb. Many folks will leave it on there until it gets a little achy and painful and then take it off. You're not quite getting all the benefits of the ice if you do that. So hang in there. It's going to get a little achy and painful before it gets numb. 15-20 minutes, right around that time is when you'll notice the benefit. I like using ice for acute injuries, redness, swelling, inflammation, or pain even. I like ice. Many of my patients from the Midwest just know they hate ice, and so I give them the opportunity to do heat. Heat. Many folks I talk to who use heat will get an electric heating pad, or they have those rice or kind of corn husk kind of bags that they'll throw in the microwave for a little bit. We use kind of these clay pads that we put in hot water that give a moist heat. Moist heat has kind of increased advantage to penetrating a little bit better than other forms of heat. We use a towel just to help give that barrier for safety so we don't burn. I like using heat over sore or achy muscles around areas of joints that we're going to get ready to be moving, to be active, or people who are going to be doing their home program or having to kind of get up ready for the day. I tend to avoid heat if it's an acute injury, if there's swelling or quite a bit of swelling, just because ice historically does better in those situations to reduce some of that inflammatory effect, some of that swelling. So typically heat, same kind of protocol with ice. 10 to 20 minutes, somewhere within there is fine. I get a lot of patients who have already had a TENS unit from a previous injury, and I get a lot of questions if they can use it in other areas, and then how to place the electrodes or the pads. Certain knee injuries respond better to a TENS unit than others. And when you have two channels like this, you take one lead, and I always say surround the area of pain. Like many folks will have pain right here in the front part of their knee. You want to surround the area and keep most of the electrodes on the skin tissue. And in this setup, you typically want to go in series. So these will go up and down the line here, and the other pair will go on the other side, just like it, to surround that area. Now every TENS unit, sometimes the electrodes need to get a little bit wet, just with some water, because that helps get the electricity into the area, into the skin, so that you can get the benefit that you're looking for. Okay, a little bonus tip. I get a lot of people saying, yeah, I elevate. My ankle's swollen, my knee's swollen, I elevate. What I mean elevate, I mean get this knee way above your heart. I mean, it has to be up. Many folks will say, yeah, I put two pillows underneath my knee so the knee is just barely above the height of the table. We want to get that leg as high up as we can so we can elevate and help with all that swelling to drain, get reabsorbed, get cleared, so that'll help with that knee recovery and knee injury. Anytime we have swelling kind of below the knee or in an area where we're in a dependent position, all of our feet swell towards the end of the day. It's totally normal. In the case of an injury, you want to get 30 to 40 minutes of aggressive elevation like this, where they're up as high as they can get, usually at the back of a headboard. Lay in your bed, opposite way, head down towards the foot of the bed, legs up on the headboard, get it way up. You'll find a great deal more benefit doing it that way. I hope you enjoyed Technique Tuesday. We answered a few questions as to should I ice or should I use heat, for how long, can I use a TENS unit, and then what does it mean to elevate. If you have any questions about any of the above, feel free to leave those comments below. Have a great day.